Hey everybody, welcome back to my channel. I'm Dr. Courtney, and today we're going to be covering prolapse. I get so many questions around pelvic organ prolapse, and I'm just going to make this one and done video and be able to explain all of the details, advice, common misconceptions, and things about prolapse that just need to be cleared up. So that way, if you're watching this and you do have pelvic organ prolapse or have just been recently diagnosed with it, it can hopefully give a little bit of ease to your mind and provide a little bit of hope for healing. So let's get into it. So let's first start by talking about what is pelvic organ prolapse. So here is my pelvic model. Inside of my pelvic model, I have organs. Okay, so I'm going to take them all out and we're just going to put the bladder inside, for example. So with pelvic organ prolapse, one or more of these organs, which are your bladder, your bowels, or your uterus, collapse inside of the pelvic cavity, meaning one of these organs just drops low into the cavity towards the entrance of the vagina or the entrance of the anus. And so basically why, or the potential reasons that this could happen is because when you lose ligamentous laxity, or when you lose ligamentous support or connective tissue support inside of the pelvis, inside of the pelvic model here, obviously you can't see any ligaments, but inside of here is where you lose some of that laxity. So your native tissues give way or become lax. And over time, your pelvic organs are supported by those ligamentous and connective tissues. So over time, whether it's risk factors or, for example, it's something happening with like a birth trauma. There's a lot of reasons that go into why pelvic organ prolapse can happen to somebody. But for the most part, when you lose that structural support that's inside of the pelvis, the organs gently kind of come down towards the entrance of the cavity. And over time, it could lead to coming outside of the body. There's different stages and grades that we utilize as medical professionals to grade the level of drop inside of the pelvic cavity. I'll put a picture here so you can kind of see the different stages as well as the different types of organs that may proceed outside of the body. And keep in mind that this diagnosis itself sounds a lot scarier than it is, because you can have pelvic organ prolapse and have absolutely no symptoms whatsoever. And then you can have someone who does have pelvic organ prolapse and they have a lot of symptoms. It really just depends on the extent of maybe how strong their body is to begin with. How weak is their pelvic floor, right? Because underneath the pelvic organs lies your pelvic floor muscles. So you can see the muscles here from the outside as well as from the inside. So those muscles itself, when they are weak, and your organs are now descending and kind of riding further down into that cavity, they have to do a lot more work. And if your pelvic floor muscles aren't kind of strong to begin with for many, many reasons, then you're going to feel more symptomatic. And for a woman who has pelvic organ prolapse, what that looks like or feels like is heaviness, pressure, maybe like a tampon sensation kind of like falling out of the vaginal canal, right? Or for someone who has like a rectocele, which is where the anal, like the bowels kind of cave in into the vaginal wall, somebody might complain of like heaviness or like pressure in the rectum. It feels like they are constipated and they just can't get it out. Sometimes there's pain. Sometimes you also get symptoms like bladder symptoms like leakage, urgency and frequency of urination. And then even with like a uterocele, maybe it's hard to even wear a tampon, especially on your cycle. It kind of just like pushes out of the body, or your uterus just really doesn't support any type of structure inside because there's just not enough room. So it kind of just pushes it outside the body. So everybody's going to present differently. Most present with those kind of symptoms that I just mentioned, but for the most part, symptoms can be really, really nagging. And when I want to go back to is talking about how you can have prolapse and have symptoms, and then you can have prolapse and have very little to no symptoms. And everybody's journey will look different depending on how well adapted their body is. So now let's get into some questions that I get frequently, and let's just kind of lay it all out to see if, is this something that you should really worry about? How can you fix this? What is the best next step for you after a diagnosis? Is surgery an option? Should you have surgery? Should you get a pessary? Let's get into it. The first question that I always get is, can prolapse go away? Can it actually be healed? And first and foremost, to answer this question, not necessarily. It can't just magically be healed, right? Like it actually has to go back up into the cavity. And that is very, very hard to do. Conservative treatment of pelvic floor physical therapy has been shown to, yes, help the organs get ascended into the cavity a little bit more, 1 to 2 grades. That is by pelvic floor strengthening, glute strengthening, abdominal work like deep core strengthening, and changing your lifestyle and habits. There are things that can actually improve your graded level. But for me, I don't always love grading. I don't always be like, okay, yeah, we went from a grade 3 to a grade 1. Sometimes that's really nice to just kind of hear like subjectively. You're like, okay, yeah, like I'm reversing the stages. But keep in mind when you are graded, like a grade 1, 2, 3, 4, it is basically for medical professionals and insurance purposes. It's for something for us to really document on paper that we can show and justify to your insurance carrier that, hey, this person is making progress, or this person has a really bad grade, for example, like a 3 or 4. And according to the medical definition of a grade 3 or 4, this person is, qualified to have surgery, for example. Or this person is qualified for pelvic floor physical therapy because they need it because their grade is bad, right? So I don't really love grading my patients myself because honestly, it doesn't matter what grade you are if surgery is not even an option and if you're not even really using your insurance. Like if you're not going to pelvic floor physical therapy and utilize your insurance in person, or utilizing surgical methods, right, for a treatment option, then it doesn't really matter because a grade 3 or a grade 1, the person can present with the same symptoms. Somebody with a grade 1 can be very symptomatic, someone with a grade 3 can be very symptomatic, and then vice versa. You can have someone with a grade 3 who has no symptoms whatsoever, and then you can have someone with a grade 1 who has a lot of symptoms. So, like I said, I don't really love grading it. So when it comes to actually healing prolapse and fixing it and making it go away, what we focus on a lot is basically symptom management. So when it comes to symptom management, what we have to focus on is making sure that the person who has prolapse knows how to manage pressure in their abdominal wall and in their pelvis. Because what really makes prolapse worse is pushing down on the organs even more, right? And how can we push down on the organs even more is by typically generating a lot of intra-abdominal pressure inside of the abdomen, and that pressure from the abdomen pushes down into the pelvis. So we're going to use the pelvic model again. You generate a lot of this pressure in here, and that pressure goes downward even more on those organs and towards the pelvic floor, towards the entrance of the vagina. And sometimes that pressure, yes, comes from lifestyle habits, maybe bearing down on the toilet, for urination or bowel movements, maybe heavy lifting in the gym, maybe a laborious job, picking up kids, picking up heavy things from the ground, breath holding. Those are like true pressure mismanagement strategies that someone could potentially do. But then there's also other factors that increase the level of symptoms that people have. And that can be something like load intolerance. Maybe their pelvic floor is just too weak, so they're having symptoms all the time, right? Or it's somebody who is an athlete, for example, and they have pelvic organ prolapse. They're doing too much workload that is tolerant for the pelvic floor, meaning the pelvic floor's critical threshold is low and they reach that bar really fast. So you need to get the pelvic floor stronger in order to withhold the amount of volume that person is doing maybe in the gym. So maybe they're running and they're lifting and then they go home and they play with their kids all day and they're doing all these other activities throughout the day. And that's what's actually contributing to a lot of their symptoms because their volume overall throughout the whole day is too much for their pelvic floor to handle, which then increases their symptoms throughout the day or by the end of the day. So when it comes to symptom management, it looks like managing pressure, managing volume of where you're at in this stage of life, making sure you're not doing too much activity, making sure that you're really just honing in on things that support recovery. Maybe you're focused on sleep management, stress management, making sure that you're eating proper food so your digestion's okay, so that doesn't increase constipation or urination issues that can lead to bearing down on the toilet. So when it comes to symptom management, and something that I do when I work with people online and a lot of my team does, is making sure that we look at someone's lifestyle, their habits. What are they doing day in and day out that could actually be contributing to symptoms way more than they would ever believe? And this goes to show too that like exercise, for example, is not really the enemy. Load intolerance is, and volume is. When you're doing too much over time, that can lead to symptoms. It's not that it's the exercise specifically that causes symptoms, because maybe you've heard from people, okay, you can't squat, you can't deadlift, you can't lunge. It's never that is the problem. It's how you load the system and where your tolerance level is, and how can we push that tolerance, graded exposure, so that way you get stronger over time, because the body adapts to strength, right? That's how we get stronger, is we load and load and load. And over time, you go from being able to lift 5 pounds to being able to lift 50 pounds. The pelvic floor is just the same, just like any other muscle group in the body, and you want to treat it as such. So when it comes to symptom management, yes, over time, you might reverse a grade 1 or a grade 2, right? You might go back into those smaller stages. And yeah, that looks good, right? That looks good on paper. It makes you feel good. It makes you feel like you're making progress. And that's what we like to see. But overall, to say that we're able to fix it and make it go back up to absolute when we were born, that's unrealistic. It's definitely unrealistic. The next question that I commonly get is, do I need surgery for prolapse? And that answer is, it depends. Because for somebody who is a grade 3, grade 4 and very symptomatic, they've had a very traumatic birth, for example, they've had a lot of long history of bad habits, maybe multiple vaginal births, long pushing phases, maybe instrument assisted deliveries, someone in that specific season of life who has like a very, very severe case of it or multiple prolapses, they might be a really good candidate for surgery. If that doesn't sound like you for where you're at right now, and you're like, oh my gosh, like maybe I do have a grade 3, but I'm not really symptomatic, then surgery is not really number 1 on your priority list, I would say. I would go conservative treatment first, pelvic floor physical therapy, an actual strength training program with pelvic floor physical therapy. Let me say that, because that is very important. You don't want to just like mosey through like clamshells and bird dogs and breathing exercises and expect that to be pelvic floor physical therapy, because that is not the definition. And that's a rant for another day. But for the most part, surgery is a tool in the toolbox to help somebody who's exhausted all of the other methods, exhausted conservative treatment, maybe exhausted wearing a pessary, and they're just not seeing any success. Then maybe surgery is on the table. Maybe surgery is also on the table for somebody in their late 60s, and they've been dealing with prolapse for so long, and it's harder to build strength at that age when you're not really used to having that lifestyle. It's a lot harder to do those things later in life if you've been struggling for so long. Not to say that it's not possible, because it's definitely possible, but for some, it's just harder. So all in all, surgery is there as needed, but my opinion is to definitely exhaust conservative options first and foremost as much as you can, because literally I have had women cancel their surgeries. Like, we've gone through our 6 months of rehab. We've gone through the traditional phases of rehab and strength training and performance training, and they find out that they can run and jump and lift again and never need surgery. So they cancel the surgery and they're going back into doing their typical activities all over again with symptom management. Sure, they're going to have flare-ups and symptoms, but that doesn't mean that it's the need for surgery, because you can have a flare in symptoms just like you can have a random flare in knee pain and it go away. And that's the goal that we teach people, is like, the goal is to never be symptom free 100%. Like, that is very unrealistic. And for women to believe that symptom free 100% is the goal, you're living in la la land, like, really. And sadly, because your body ebbs and flows through phases of life. How much sleep you get, how much stress you have, what kind of food you're eating. Maybe you have a lot going on in your life. Maybe you're unable to exercise for a little bit of time. Maybe you're going on vacation, or maybe you're having to travel a lot for something. Like, there's so many things that happen in your life that influence your symptoms that have actually nothing to do with like how strong your pelvic floor is and why you should need surgery. The last thing I'm going to say about surgery is that surgery doesn't take away your habits, your lifestyle choices, and your lack of strength. Let me say that again. If you want surgery as an option, you still need to do conservative treatment. You still need to get strong. You still need to change your lifestyle and your habits and the decisions that you make every single day. You still need to clean up your diet. You still need to manage your stress and manage your sleep. You still need to do all of these different lifestyle changes because yes, there is true trauma that you can result in prolapse. But a lot of the times, and a lot of women actually get prolapse from their lifestyle and the way they live their life and the things that they've done since they were a teeny bopper, all the way until their 50s and 60s. The combination of all of these things is like a perfect storm in creating prolapse. So if you just expect that surgery is going to take away the prolapse, it's silly, because that's why prolapse surgeries can sometimes fail, and why you're going to see in horrendous Facebook groups and posts from women that are like, oh, I got the surgery and it failed. Oh, I got the surgery and I still have all the symptoms. Oh, I got the surgery, I still leak. I still have pressure. I still have heaviness. It didn't work. And now I have to have it again. And that's the other thing. Prolapse surgeries only last 8 to 15 years. And sometimes I've seen it where they fail within less than 1 year because the lifestyles and the habits of the person that got the surgery, it never changed. So while surgery is an option, it's not the only option. And my first and foremost recommendation would be to exhaust true physical therapy, which really, really focuses on strengthening the whole body, every single muscle group that goes around the pelvis, because that's how the pelvic floor gets relief. Because if everything else is like really weak around the pelvis, like your hip flexors and your adductors and your quads and your hamstrings and your glutes and your deep core and your low back and everything else that attaches to the pelvis is weak, guess what's going to take way more effort? What's doing a lot of work? Your pelvic floor muscles that are literally at the bottom of the pelvis. The pelvic floor muscles have very specific functions. One of the functions is to not support the whole freaking body. And oftentimes, we get so weak and deconditioned over life and pregnancy and postpartum. Everything around the pelvis gets so weak, the pelvic floor starts doing jobs that it's not supposed to do, which leads it to being chronically tight, chronically weak, chronically symptomatic. And so when it comes to treatment of pelvic organ prolapse, get everything around the pelvis strong. True strength training. And I'm talking compound lifting patterns. Squats and lunges and deadlifts and overhead presses and rows, and actually a strength training program can get you far better results in relieving pelvic floor issues like tension and weakness and overall that chronically tight feeling that you're going to have with prolapse. Because again, when you have prolapse, your pelvic floor muscles are chronically on and clenching and tightening and trying to provide support. And if they're just weak, over time, they give. And what does that lead to? Symptoms. So when it comes to conservative treatment, you need a strength training program. Work with somebody who literally knows what they're doing, has had hundreds and hundreds of patients and positive experiences for people, and can get them back into the activities that they love doing. Because that's truly what's going to provide you long-term symptom relief. Not surgery, not a pessary. You need the compilation. You need the option. You need the option to get your core and your pelvic floor stronger by way of strengthening the whole body. And I will get off my soapbox on that topic. Another common question I get is what exercises are safe versus unsafe? And I obviously just talked a lot about how strength training is really, really helpful for prolapse, but there really is no such thing as safe versus unsafe. Like, throw that out of your vocabulary, because movement is movement and movement is healing. And we're human beings that require movement. When you think back into the old days, right? The caveman days, like, human beings are mammals. We are meant to move. We are not meant to be sedentary. We are not meant to not exercise. So for physicians and physical therapists to tell you to not exercise or to not squat is absolutely ridiculous. There is no such thing as safe versus unsafe. The literature supports this. Any literature that says you can't lift but more than 15 pounds when you're pregnant or 20 pounds with prolapse is outdated. It is no longer evidence. that is like today in current day's age. I always tell people, I'm like, your physician is as old as the last research article they've read, because nowadays, like, that is unsupported. Because guess what? When you're squatting and you're bending over to pick up things in real life, like maybe your baby carrier, a bag of dog food, a huge thing of water, you have to do that movement pattern. So why don't we strengthen that movement pattern in the gym and learn pressure management strategies that help you get confident in doing that mechanism of movement? There's no reason that it's safe versus unsafe. So I'm just going to throw that one out the window. Like, you can do any exercise. It's not what you do, it's how you do it. And that's when you need to work with somebody who's a professional who can teach you the how, who can teach you pressure management strategies, who can teach you how to utilize your core, how to utilize your pelvic floor, how to utilize your breath when you're lifting with squatting or deadlifting and a barbell and dumbbells and things like that, who can teach you these high impact things so that way you have the confidence. Because one thing is physical health, right? Yes, we want that physical body strength, but another thing is the mindset. Because if you're fearful of loading and fearful of going to the gym and doing certain exercises, you might hurt yourself just based on the fact of being fearful, because your mindset's going to hold you back 10 times more than your body actually will. So if you're not confident in your ability to lift or do things like that, then you're not going to be good in the gym anyway. So you need to focus on the mindset first and foremost, because movement is healing. And once you convince yourself that exercise is going to be the solution to healing prolapse, then you're going to actually start seeing results. So first and foremost, work on the mind, and that will lead you to success in the gym. Another common question I get is, will prolapse get worse over time? And if you do nothing, yeah, it will. Like, if you do absolutely nothing, if you change nothing about the lifestyle that you live right now, learning how to actually mitigate pressure in the abdomen and the pelvis and getting stronger, like, over time, yeah, it does actually worsen, because it's just more and more weakness that generates in the pelvis. And yeah, it can make those symptoms appear worse than they used to be. And obviously, as we get older, we lose our good hormones, estrogen, progesterone, and gravity plays a role too, right? So over time, it is normal for women to experience prolapse in their 70s, 80s, 90s, because gravity does its thing. So if you already are experiencing prolapse and you have a grade 1 and you have a grade 2, like, now is the absolute time to do something about it. Don't wait until it's too late. Another common question I get is, can anybody get prolapse? And the answer is yeah. There is actually women who are in their early 20s who have been diagnosed with prolapse. And the reason is because, like I mentioned, there's a lot of risk factors that increase the risk of having prolapse. A lot of people don't know this, but even women who have hypermobility, never having any kids, but just have hypermobility, if they're on the spectrum of hypermobility, then you can experience prolapse at any age, right? So there's a lot of risk factors that can cause prolapse, I would say, but don't think that only pregnancy or a vaginal birth or getting older is the only way you can get prolapse. Because really what it comes down to is lifestyle and habits and pressure mismanagement, and those are the things that cause it. Like I said, having a traumatic birth or even having a vaginal birth, a long pushing phase of labor, those are just one thing of risk factor, right? Like, that's just one risk factor that can be compiled on layers of multiple risk factors. So yes, anybody can get prolapse at any age of their life. Probably like teenager years and above, but I wouldn't put it past somebody to get it when they're young as well. Another common question I get is, can I have more kids if I have prolapse? And the answer is yes. There are plenty of women who have had multiple kids despite having prolapse. The extent of prolapse, like a uterocele, maybe like a grade 3 or a grade 4 of that, can make it difficult to have a child, because your uterus is so far low in the cavity that it just makes it more risky. And some physicians might caution you to get pregnant or carry full term because of that. But all in all, like a bladder prolapse or like a rectal prolapse, those are types of prolapses that really don't impair your ability to get pregnant, to have intercourse, and then to have a child. Another common question I get is the other types of symptoms that might come with prolapse, and that is usually like bladder symptoms or bowel symptoms. And so you have to recognize that if you do have bladder prolapse, for example, you might see issues with your bladder. You might see more leakage. You might see it with like coughing, laughing, sneezing, running, jumping, lifting, or maybe like bending over or walking, transitional kind of movement patterns. You might also get an increase in urgency. You might get an increase in frequency of urination. Just because the bladder sits lower, you're going to have more pressure onto the bladder, right? So it's not in its normal anatomical position. So you might notice some symptoms with that. Another thing for the bowels too, you might see more signs of like loose stools or even like constipation, more pressure in the rectum, more pain with bowel movements, maybe even some bleeding, maybe even an increase in hemorrhoids or like anal fissures. So you might notice some more like IBS-like symptoms. Sometimes it can like really back you up. So you just want to keep in mind that if you do have bladder or bowel prolapse, you might see some of those symptoms. So again, I want to put another plug that if you're in pelvic floor physical therapy, I would highly recommend that you share all of your symptoms with your providers. So that way you can address those bladder symptoms as well as the bowel symptoms all together. I'm going to wrap this video up by answering one of the most common questions I always get is, I have no idea where to start. I'm so overwhelmed. I just got diagnosed. What is the first thing I should do? Obviously, I've said it multiple times in this video, but it is to definitely work with a professional. And I don't just say a professional like a pelvic floor physical therapist, because not all pelvic floor physical therapists are treated equal. Not all pelvic floor physical therapists are knowledgeable in pelvic organ prolapse and how to treat it. Yes, they might know what it is. Yes, they might know how to decipher a rectal prolapse from a bladder prolapse. They might know the actual anatomical, physiological things that can happen to the body, but not every provider is qualified to treat it. And why I say this is because I took the classes. I got my certifications, and they don't teach you exercise prescription. They don't tell you how to treat it in exact ways that it needs to be treated. They might give you textbook definitions of do Kegels, strengthen the pelvic floor, strengthen their core, teach them how to breathe better. And that might be your treatment that you get, because the extent of that pelvic floor physical therapist knowledge might honestly stop at what they learned in a weekend course. So it's important to find somebody who has experience in you, first of all, whoever you are as far as your identity. Maybe it's a mom, maybe it's an athlete, maybe it's perimenopause, maybe it's menopause. Whatever it is, you want to find someone who's specialized in your identity, because that's what's going to get you to where you want to go. If you're an athlete, you need to see somebody who can help you get back into athletic activities. And keep in mind, if you have pelvic organ prolapse and you are told to just breathe, stretch, and do some Kegels, and then stop running and stop lifting, that's not the provider for you. That just instills fear. And that's fear mongering. And that's not the type of provider that is the best fit for you. So keep in mind, pelvic floor physical therapy is number one. Number two is finding the right provider. And number three is getting really strong. Making sure your pelvic floor has good range of motion, so that way you can strengthen the pelvic floor muscles itself, as well as all of the muscles around the pelvis. Because like I mentioned earlier in the video, that's how you truly support the pelvic organs, because the pelvic floor muscles can then do their job of keeping the pelvic organs happy. And when you have load dispersed away from the pelvic floor and the pelvic organs, your pelvic organs are going to be way less irritable, which means you're going to have way less symptoms. So that is my number one recommendation, is where do I start? And another thing that would be to where you would want to start is understanding how pressure generates in the abdomen and into the pelvis. Because when you understand that relationship, you know how to support your core better, you know how to breathe better, and you know how to manage that intra-abdominal pressure that pushes down into the organs that you don't want to have. I have a lot of extra videos on my YouTube channel about this. Just go ahead and type in prolapse and pressure management into my YouTube channel, and you'll be able to find those, as well as I'll try to link them below, so that way you can find those videos and understand it a little bit better. But that's where you really need to start. And when you understand how to support, I already told you, it doesn't matter what you do, it's how you do it. So you can go and complete an exercise program or reach out to me. I have plenty of programs available that are rehab starting points for women with prolapse. That's what I do, obviously, virtually online. I work with women all over the world to be able to help provide that solution that they are missing in terms of their identity. Whether you're a mom, you're postpartum, you're pregnant, or you're an athlete and you're wanting to get back into activity, but you just haven't found that person that's able to help you, just reach out. We would love to be able to help. You can reach out to me on Instagram. But that concludes my rapid fire Q&A about prolapse. And as always, if you have any more questions about prolapse, if you're nervous, if you're scared, if you're fearful about what to do next, or if surgery is a good option for you, send me a DM. I'd be happy to help. Make sure you drop some comments below and I'll make another video. But yeah, I hope this was helpful. And as always, if you like this video, make sure you like it and subscribe to my channel for more videos. So that way you stay in the loop and stay educated. Catch you next time.